I haven't had a chance to look at all the abstracts, but one thing that did catch my eye is the LEAP-02 study. This was a basket study in patient with microsatellite stable colorectal cancer in combination with Pembrolizumab and Lenvatinib. This is an interesting concept because obviously we know that immunotherapy does work in colon cancers in patients who are MSI high. So I think that's been established, and that's considered part of the standard of care. But unfortunately, 95% of the patients are microsatellite stable, meaning that they will not respond to immunotherapy alone. So there's a lot of work done trying to convert this, what we call cold tumor, to hot tumor by adding different agents. And one of the agents that's been added is a TKI, such as Lenvatinib, which can potentially change the microenvironment and make the tumor more sensitive to immunotherapy. So this trial included, I believe, around 30-some patients in patients who are microsatellite stable, and they received a standard dose of Lenvatinib and Pembrolizumab after failing standard chemotherapy. And the result was somewhat intriguing because the response rate they saw in the study, at least for the abstract, was about 22%. Which is much higher than you would expect to see with a single agent immunotherapy or Lenvatinib alone, let's say, as a single agent. And this is because in the past, there has been a lot of the different combination with a different TKI in immunotherapy that has been presented. For example, in JCO, was it last year, 2 years ago, a Japanese group presented their data with combination of regorafenib and nivolumab in microsatellite stable patients. And at that time, the response rate was about 30%, obviously, which is very impressive in the subset of population. However, the data that was presented a little bit afterwards with similar combination with regorafenib and nivolumab, which was mostly done at Moffitt Cancer Center, was presented at GI ESMO with 20-some patients. In that study, the response rate was less than 5%. Even though 5%. And recently, last year at ASCO, there was a combination of regorafenib and another PD-1 called avelumab, which was studied as well. And in that study, the response rate was once again also less than 5%. So this trial shows that, that this may be a little bit, maybe an outlier. It is unclear why the combination of Lenvatinib and Pembro would have a response rate of 22% in microsatellite stable patients, while the other combination with regorafenib and different checkpoint inhibitors has a response rate less than 5%. Once again, the Japanese study seems to be a little bit outlier until this study is being presented at ASCO. So obviously, it'll be interesting to look in more detail to see if there's a difference between those studies that I presented. Because once again, this is a highly unmet area, and if you're able to convert this cold tumor to hot tumor, a lot of options may exist for those patients. So I'll be eager to see some of the poster presentation with the combination of Lenvatinib and Pembrolizumab in this setting.